Today we are here to see one special case. A 38-year-old lady, a very young lady, Mrs. Gowri Priya, she came one evening with a severe back pain which was going down her legs. The pain was so much intractable. When I asked her whether there is a back pain or there is a leg pain, she said that since last almost more than 1 year she is having back pain. But since last 15 days she has started having leg pain. Leg pain is not getting better at all. She has taken umpteen number of medicines. She had similar episode of leg pain twice earlier. She had taken some medicines which killed her pain, but she did not get a definitive relief. When I saw her, when I examined her, I told her this is the problem which is related with one of the nerves. Her L5 nerve was at a most compromised position. Between 4th and 5th lumbar vertebra, the disc which is present, which is acting like a cushion, is pressing over the nerve, which is going down the leg, and that's why she is experiencing the back pain and the leg pain.
2 years back, I tried to bend down to lift something. Immediately I got a feeling of current passing to my spine. So I thought it was a natural normal pain, but after few days it was getting aggravated. So I took some local painkillers. I was okay within a week. Then again after few months the pain started getting aggravated. Then I consulted a local doctor. He took my x-rays and he gave me some medications. Again I was alright within a week. So it continued for 2-3 months. Then I thought I was completely okay. So I planned for a houseboat trip to Kerala. Then all of a sudden, while enjoying myself with my kids, I started developing a same kind of pain. Then again I took some local painkillers, but that time those medicines were not helpful to me. My husband took an appointment with Dr. Ketan Kurjekar, wherein he looked at all my reports, MRIs, X-rays. I was detected with disc herniation. Then he told me to go for a spine surgery. That was the only option left out because I was already at the advanced stage.
I just explained her that our lower lumbar spine, if we look at it, it looks something like this. If we say now this is the lower aspect of the lumbar spine. We call the one vertebra here is L3, this is L4, this is L5, and this is sacrum. Now the gaps which are seen in between, these are the discs which act like a cushion. Few people may call it as a disc, few people may call it as a cushion. They act like a spring, they act like a shock absorber. And one of the most important function of this vertebral column is to protect the spinal cord. Now the spinal cord is one of the most important structure which carries all the important signals which are going down, coming from the brain, going down the legs. At every level, every nerve is giving some signals, some compression. In Mrs. Gowri Priya's case, the disc which is present between 4-5 was coming out and extruding and protruding and pushing the spinal nerve, and as a effect the spinal cord is getting pressed and getting pushed on one side. If you take a cross section here, if this is the spinal cord normally, and if I have to draw a vertebral column which goes something like this, now this is a transverse section. In Mrs. Gowri Priya's case, the disc which is present here is coming down and causing pressure over the spinal cord, because of which the spinal cord is getting tilted and getting pushed on one side. This compression is causing a severe leg pain to the patient.
She could not get up from the bed every morning. Her pain persists from the morning till the afternoon, and that's her school timings. So every morning she used to get up and tell that, sorry, I couldn't send you to school.
I told her one of the newest modalities which we follow is a microscopic discectomy, wherein which we use a pipeline system. It's a keyhole procedure wherein which we put the pipe which goes something like this, and this pipe takes out the disc which is pressing over the nerves. This minimal invasive technique is very precision based, very accurate, with the less of blood supply, with the highest neurological recovery, and the patient is symptom free as early as possible. Mrs. Gowri, Priya, her family, they were in very much two minds. They asked me whether they should try some Kerala massage or whether they should try some other pathies. I told her that these are the ways to get better, definitely, but this is more scientific, this is more assuring. We can prognosticate the recovery, we can guarantee the success, we can say that this will give a speedier, faster, better outcome after the microscopic discectomy. Mrs. Gowri Priya underwent a surgery wherein which this disc was removed with the help of a pipeline system, what we call it as a minimal invasive spine surgery, and we got the spinal cord back to its position.
That operation was just 3 hours operation, and the next day she was able to walk with the stick, and third day she was completely alright.
After the surgery, now I can enjoy with my mother, and now she's preparing delicious food for us which we had missed for such a long time, and now she's also helping me in my studies, fit and healthy as she was earlier.